Good evening, everybody. So I know I said I would probably do this video from the healing garden, but I had some other things I had to do after the hospital, and I just needed to kind of enjoy the weather and take a walk and clear my head after the consultation. It was a lot of information, a lot of serious information pertaining to my liver and my portal vein. So they gave me this booklet, basically on the T.I.P.S procedure. Inside, it kind of explains everything. It talks about cirrhosis and stuff like that, the treatment options, and they say, what is T.I.P.S? T.I.P.S is transjugular intrahepatic portosystematic shunt. So basically it goes to the jugular vein, and he said they stick this, like, how did he say it? It's like a spear. They stick a spear through your liver. And they put it to the portal vein, which gives the general circulation. And the shunt, they put a shunt in, which gives a different area, channel, vessel for the blood to flow through rather than my portal vein. The benefits of the T.I.P.S procedure: it treats portal hypertension, ascites, and varices, which obviously I have the varices, so it's going to lower my risk of having GI bleeds, which is very good because a GI bleed obviously is very serious, and you can die from a GI bleed because you can literally bleed to death. So that's a good thing. It will help calm my varices down. My portal hypertension is the reason why I have the blood clots and all that. So that's going to help the portal hypertension. I don't really have a huge issue with ascites. My legs do swell up with water, but I'm on diuretics and they work pretty good. So this is just kind of like an extra benefit to the ascites, where I've never had to have periocentesis done or anything like that, which is a good thing, and that's just not a complication of mine. So those are the benefits. Also, because of the shunt going in and being able to control the blood pressure and all that through my liver, it helps me prolong my life a little bit. Without a transplant. Obviously, I'm going to need a transplant. They told me my liver is pretty bad. So they did warn me that there's a high risk of death. So anyway, I apologize. I had to pause for a second. I do have a high risk of, death. A little bit higher than most people because my liver is so bad. We're going to pray that doesn't happen. We're going to pray that I make it through the procedure and everything goes A-okay. Right now, I'm waiting. They did say I probably might have to stay in the hospital anywhere from 1 to 3 days, simply because they have to make sure the shunt is working, so they do an ultrasound like within a day afterwards. And then they also watch for hepatic encephalopathy right away because it can come on so quick. That is a complication, a downside for me. Let's see. I took some notes too. Not only did I have a booklet, but I took notes with me. They said that if I start having a huge issue with hepatic encephalopathy, that then they would obviously have to close the shunt down because I'm just getting too much toxins to my brain, and it's not like a big issue, only like what I think they said 10% of the people have that problem, to where the encephalopathy just doesn't go away. But a lot of the people have issues where it comes and goes, and it comes on very quickly. Because I already have that complication pretty bad, I have to be very careful. There's 2 medications that they put you on to help you for that. One, make sure that you obviously have continual bowel movements. You want to have, they want me to have like 3 to 5 a day, to make sure that my system is cleared out of the toxins and all that. So I'm medication for that. And then I'm also on another medication for like my portal hypotension. Portal hypertension. There we go. So it's just so much information. I do apologize. So I'm on medication for that too. So that will help take the risk down of me having hepatic encephalopathy. They did test me for it today, passed with flying colors, because I do not have it right now. Risks, they'll give me an antibiotic before the procedure, which is what they did with my port. Oh, and look at my bandages. Finally came off my new port. This is the old port that they had to take out right there. This is the new one that they put in, and obviously I have a lot of bruising. And then this is actually where they go into your jugular right here for the port, and they put the wire down into the port. So this is probably the same vicinity that they're going to be going in for this T.I.P.S procedure. And then they go obviously down into your liver. Sometimes they have to go through, what is that vein called? The other vein that's down below in your pubic area, your femoral artery. But that's something that would only happen if need be. Obviously, if they can't get the shunt to work, it's just not going to work. So they're going to pull out because of my complications and all that. They have to talk to the person that's doing it, the doctor, and make sure that they're all on the same page as to what's going to happen during the procedure. So infection obviously is a risk. That's why they give you an antibiotic before the procedure. You can get vessel damage because they're taking that spear through your liver. So vessel damage. Blood clots. I could get blood clots. And liver failure. Death. Basically, if I go into liver failure, it's going to be a rush to try to get me a new liver within a certain amount of time. And yeah, you can't live without a liver. So if I go into liver failure, we'll have to take it from there, I guess. So I'm praying, going to stay positive that I don't. So, and then obviously, cardiac issues. You can develop cardiac issues because of the shunt. And then obviously the hepatic encephalopathy is another risk for the procedure. The cons or the pros, if it works great, it's great. It can prolong your life a little bit. Your life can be much better because of the shunt. I might finally have normal blood pressure. Right now my blood pressure runs very low. My heart rate runs very low. So hopefully, an example, my blood pressure is normally like 90/49, and my heart rate ranges anywhere from like 54 to 63. So I have a watch that takes my heart rate, and then I can email all my results from the week to my doctor, and my doctor can see like my fluctuations in my heart rate. But they also obviously do your vitals when you go to the hospital, like they did to me today. I did check in and all that. So yeah, it was, like I said, very informative. They talk about what happens during the procedure. They'll use x-ray pictures. The long thin needle is guided through the introducer sheath to the hepatic vein. They put the stent in, blah, blah, blah. I'm not going to get into all the information. Risks: fever, infection, stiffness, bruising, bleeding, blockage, cutting of blood vessels in the liver, heart problems or abnormal heart rhythms, infection of the stent, and death. Following the T.I.P.S procedure, typical hospital stay is 1 to 3 days or possibly longer. During that time, your doctor will monitor your blood pressure and may conduct an ultrasound study of the liver and stent to make sure that the device stays open. They did say that for sure they were going to be doing that. After going home, I'll be on like a low protein and low salt diet. Then they said, medications may be prescribed to minimize the accumulation of blood toxins, which I'm already on those medications. So I won't have to be prescribed those because I already have them. Then it talks about how you'll know if it's working, signs if it fails. They give you more places to go if you want information, like the American Liver Foundation, U.S. Library of Medicine, stuff like that. So, little booklet, and like I said, I took notes as well, and I have a little card for my nurse or whoever is going to be taking care of me during the procedure. Right now, I'm waiting to get approved by the anesthesiologist and my liver transplant doctor. I have to be approved to be under anesthesia because it is a 3 to 5 hour long surgery. And the whole time I'll be under general anesthesia and with the varices and everything else. They just need to make sure that I'm going to be okay health-wise. I did have a small physical today to make sure that I'm healthy enough to have the surgery. They checked my heart, my lungs. Again, they checked for HE, hepatic encephalopathy, today. So once I get approved, then they'll call me to schedule the actual surgery. He said it could happen anywhere from a week to 3 weeks. So that's the only time frame I really have. Once I find out, I will let everybody know what day the surgery is and what's going to, what time, what it all entails. Craig will be down here for the surgery. He'll probably stay the whole time. It depends, obviously, on how long I have to stay in the hospital and if he has any other appointments that he has to take his mom or his aunt to, because their appointments are very important too. So, it was a long meeting, very long meeting, and again, sorry, I had to pause again. It was a long meeting, a long day. I just needed to get out. It was a beautiful day outside today. Tomorrow it's going to be even more beautiful, but I have freaking infusions. Ugh. So tomorrow for sure, because it's going to be supposedly in the 70s. It's going to be beautiful. So tomorrow will be a garden center day for sure, because then I can go outside and hopefully the lake is blue and it looks really pretty and I can show you guys some more scenery. I don't know. Maybe I bore you guys with my videos. Maybe I don't. Maybe some of them are very informative. I don't know. If you ever have any questions or comments, feel free to ask me. I am more than willing to share my journey, what I've been through, what I'm going to go through, how I'm feeling, whatever, with everybody. So, how I feel scared. I'm very frightened. Not necessarily because of the procedure, but just because having to have the procedure means that things are pretty serious. And that's scary because I don't want to die. I want to live. So I'm getting the opportunity to go to Madison. And that would be for a partial where my kids could test or friends could test. Here, I'm already waiting for a full liver transplant if need be. Obviously, once I get scheduled for the procedure, because of the risk of liver failure, right away the transplant board will have things set up to go in case things go south. I guess they had a patient in there that they had to do that for today. And there was a big team of the abdominal transplant doctors and nurses and stuff there. And it was cool to see, because it was a big team. It was a lot of people that I know from the abdominal transplant unit that I've seen or talked to. Or, when I was in the hospital, we have multiple different doctors coming in and out from the transplant unit. You don't necessarily have your exact doctor coming in. She does come in, but other doctors do come in to check up on you throughout the day to make sure that things are going well, especially when I had the GI bleeds and the hepatic encephalopathy and stuff. So this transplant department is awesome, amazing. It sucks because I'm stuck in what they call purgatory. My MELD score isn't high enough for me to immediately get a transplant, like, like move my name up to where I need it emergently or sooner rather than later. So because of that, I'm kind of staying where I am on the list, and it's scary. It's scary. So yeah, like I said, they have me. They call it purgatory. I like to call it sitting in life's waiting room. You know, it sounds better than transplant purgatory, because that sounds scary. But I think I'm gonna end this video now. Again, like I said, if you ever have any questions or comments, or want some advice or whatever, want to know how I'm feeling for the day, anything, send me good vibes, send me blessings, send me prayers. I love that kind of stuff. It just makes me know and feel that I am, being thought of, and those positive vibes are coming my way. That's what I need right now. I try very hard to stay positive, but it's very, very hard. Very hard to stay positive when you're terminal. So, that's going to be it. Like, comment, subscribe if you'd like. Love you guys. Thank you for listening, and I hope to hear from you soon, and I will be putting up another video soon. I'm not really vlogging because my grandson's not here and there's really not much going on. There's nobody at home right now. I'm by myself, so I don't think you want to just see a vlog of just me all day by myself. It'd be kind of boring. But anyway, these updates, I can at least do that for now. So again, tomorrow's infusion day. Like, comment, see you later.